At 40, you feel fine. But silent killers don't knock. They glow. They wait. That's why turning 40 isn't a celebration. It is your warning hell. The best gift you can give yourself now, a full body checkup. Here is what every 40-year-old must screen for before it is too late. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are looking at what every 40-year-old must screen for without waiting. This will help you to be on top of your health and they prevent diseases getting you by surprise. What are some of the common silent killers after the age of 40? Why screening will matter after the age of 40? At 40, your risk for chronic diseases doubles. Many diseases like cancer, high blood pressure, or diabetes, and they show no early signs, but they start knocking in. They can be caught early, and they are treatable, and they are even reversible if caught early. Let's look at some of the critical screenings that we need to do after the age of 40. Here is what you should be checking every 1 year or 2 years. 1, your blood pressure. You need to keep checking it every 3 months. It prevents you from the risk of getting stroke, kidney failure, and even heart diseases. You need to constantly keep checking your blood sugar every 3 months and even your glycated hemoglobin. This screens for prediabetes, the diabetes that sets in before it presents symptomatically, and this you can be able to reverse. And we have checked this in one of the previous videos on how you can reverse prediabetes. So check that video out. Then checking your cholesterol. When you check your cholesterol and you know how it is every year, then this helps you to catch risk that can put you at risk of getting some cancers that are associated with excessive belly fat, and also preventing diseases like stroke or heart attacks. You are able to detect abnormal cholesterol early on, and then you can take measures that can keep your cholesterol on check. The cancer screenings that you need to do regularly after the age of 40. Breast exam or mammogram. Every woman after the age of 40 needs to do a mammogram every 2 years. And you also need to know how to do self-breast awareness. This is just keeping learning through your breast every month, especially after your periods, when the sensitivity of the breast is more reduced, and you can tell abnormals. And when you have learned to examine your breast on a regular basis, you'll be able to know when there is any abnormality. You can also do a clinical breast exam, and this will help you detect abnormalities. You should not also forget that a mammogram after the age of 40 is very necessary so that you can be able to detect abnormal growth and development in your breast. Then pap smears or VIA. This is for ladies, and it should be done from the age of 25 every 3 years. And this should be done so that you prevent cervical cancer. So if you have not done your pap smear for the last 3 years, this is the time that you should remind yourself and book a checkup. Then checking your PSA levels or the digital rectal exam. This is very important for men, and for the PSA, you do not need to do it as a routine test. You need to discuss your risk with your doctor based on your lifestyle, then you can decide, do you really need to do the PSA? Then the stool test and the colonoscopy. It is important that you do fecal immunohistochemical test. This is a test that checks for blood in your stool, and you can do it on a yearly basis. And then every 10 years, you can do a colonoscopy. But this will also be guided on your family risk. If there is a high risk of colon cancer in your family, then you need to do it on a more regular basis. Then skin and oral cancer checks. These are especially important for people who smoke, or those who drink, or anyone who uses things like kati, or even chewing tobacco. It's very important. Then you may need to do low-dose CT screenings for for lung cancer if you have smoked for more than 15 years. This could be what is going to change your life and save your life. Then doing an eye exam and mental health screening, so that if you have any risk of mental health risk, then you need to be screened so that you can get the necessary attention. Remember also, you need to maintain your dental checkup. Many times we forget that we need our teeth to be able to enjoy our food at old age. So it is necessary that after the age of 40, you have that regular dental checkup with your dentist to keep your dental health up to date. What are some of the benefits of early screening? Remember that early detection saves life. 90% of the early stage cancers are treatable. Yes, 90% of the cancers caught early, before they move out of the primary organ, they can be prevented. Why don't we take advantage of this information and screen regularly? Screening also reduces the risk of heart diseases by up to 40%. So don't get surprised by a heart attack. Do that blood pressure check, do your glycated hemoglobin, so that you know whether you have hypertension or you have diabetes, and also check your cholesterol levels. Early diabetes detection prevents blindness, kidney failure, and even amputation. And you can reverse this with lifestyle changes. So go for the opportunity. People who screen early live longer and live better because they are proactive and they take charge of their health. So be one of those people. So don't just catch diseases, prevent them from winning over you. So let's look at some of the things that you should do next. If you have turned 40, just get checked to stay alive. Book your full body screening at your local hospital or clinic. Know your numbers. What is your sugar level? How are your cholesterols? What is your body mass index? How is your abdominal circumference? When you visit your doctor and your healthcare provider, ask about the vaccines that you might have missed and how you can do a catch-up. So encourage your spouse, your sibling to do the same, so that all of us keep healthy. One screening could add 10 years to your life. So don't wait for pain to take action. Start today and take charge of your life. It is time to take your health seriously. So if you are 40 and above, your life is only starting. So let's make it long, healthy, and powerful. Tag a friend who needs to see this, and also schedule your screening this week. Share this video with someone who you feel needs the information. Let's keep healthy as a community.